Welcome everyone to new MemoMap. Today our map is about the venous system, the part of the circulation responsible for the return of the blood back to the heart. And in this MemoMap we will talk about four main concepts. First, the function of the vein. Second, the importance of the venous pressures. Third, the venous return. And finally, the interaction between the venous return and cardiac output. Let's start building our MemoMap of venous circulation. Let's start with the function of the venous system. The vein has two main functions. First, transport. It returns the blood back to the heart because of low pressure compared to the artery. Second, reservoir. The veins store most of blood due to the high compliance. So when body need more blood, venoconstriction occur, increasing the venous return, increase the cardiac filling and cardiac output. Let's move to the venous pressure. There are three important venous pressures: the central venous or right atrial pressures, which is the pressure in the great vein near to the right atrium. Its value is 0 to 2 and important because it determines the venous returns, the ventricular filling, the cardiac output. Clinically, we use as index for the blood volume and the heart filling. Remember, if the right atrial pressure increase, the venous return decrease and vice versa. The second pressure is the peripheral venous pressures. This pressure in the large vein outside the thoracic normal value is 5 to 6, affected by the total blood volume, cardiac output, the arterial tone, the venous compliance, and the gravity. The third and the last is the mean systemic filling pressure, and this pressure is in the circulation when the heart stops pumping, so the cardiac output becomes 0 and blood distribute evenly in all vessels. Normally it's from 6 to 8 and determined by the volume and the capacitance compliance. Most importantly, the mean systemic is driving pressure to the systemic circulation. When it increases, the venous returns increase. And now let's move to our next point, which is venous return. And here we are going to discuss 3 points: definition, the factor, and the curves of venous return. First, the definition. Venous return, the amount of the blood returned to the heart per minute. And of course, it equals the cardiac output. The factor affecting the venous return, we are classifying into two main categories: pressure and the mechanical factor. The pressure factor are the venous return equal pressure gradient divided over the resistance, and the pressure gradients is the mean systemic filling pressure minus the right atrial pressure. So to increase the venous return, the mean systemic filling pressures increase, while there will be a decrease in right atrium and the resistance to venous return. Let's talk about the mechanical factor, which are three pumps: the cardiac pump, thoracic pump, and the skeletal muscle pump. Cardiac pump, there are two mechanisms: the atrial suction during the ventricular ejection. The AV valve move down, the atrium expands, the right atrial pressure is decreased, so the venous return increase. The ventricular suction, during the ventricular filling and the AV valve are open, blood rapidly move from the atrium to the ventricle, so the atrial pressure decrease and increase the venous return. Thoracic pump, this is occur during the breathing. During inspiration, the intrathoracic pressures become more negative. This decreases the right atrial pressures, increasing the venous return. The vice versa occur during expiration, in which the negativity decrease and the abdominal pressures also decrease, so the venous returns decrease and the right due to the decrease in the right atrial pressure. Skeletal muscles pumps, when the skeletal contract, they compress the veins, so the venous valve prevent the back flow and blood move towards the heart. Let's move to the venous return circulation. We have three curves describing an important three relationship. First, the relationship between the right atrium and venous return. The relationship is inverse, and That's to say, when the right atrium pressures increase, the venous return decrease, and we have two important points. The intersection point is when the right atrial equals the mean systemic, so the venous return equals zero. The second is the plateau, and this plateau occurs when the right atrial pressure falls below -1, so the vein collapses and the venous return reaches to the plateau and cannot increase further. Curve 2 describes the relationship between the venous return and the mean systemic filling pressure when the right atrium is fixed. So, if the mean systemic filling pressures increase, the curve shift up to the right, and if it is decreased, the curve shift down to the left. Remember, always when the intersection point move, this means that the main systemic filling is changed. And this is important to determine that the curve is changed due to changing of mean systemic filling pressures. Just look to the intersection point. Okay, the mean systemic filling pressures can increase or decrease by changing in the blood volume or the compliance. Remember that increasing the blood volume but decreasing the compliance cause an increase in the mean systemic filling pressure. The third curve is the resistance to venous return. And here we fix the right atrial pressure and the mean systemic filling and changing the resistance. And the relationship is inverse, so the resistance decrease, the venous return increase, and the curve slope become more steeper. Meanwhile, when the resistance increase, the venous return decrease and the slope decrease. Here, there is no shifting or changing in the mean systemic filling pressure, so the intersection point remain constant, the same. Okay, so if we want to know whether the curve is changed due to there is change in the resistance or change in mean systemic, only look to the intersection point. If it change, so the change in the curve mainly due to change in mean systemic filling pressure. If it does not change, so the change is mainly due to the change in the resistance. And now let's bring the venous return and cardiac output curve together. When we draw the two curves on the same graph, they meet at one point. And this point is the equilibrium point, where the venous return equals the cardiac output. At this point, the right atrial pressure is 0 and cardiac output is 5 liters per minute. What happened with an inotrope? The inotrope is a drug that acts only in the heart to stimulate the heart. So the cardiac output curve shift upward. The slope increase of the cardiac output, but the vascular system does not change because the drug acts only on the heart. So the intersection point moves slightly upward due to the cardiac output increase slightly. What happened during exercise? During exercise, both curves changes. First, cardiac output slope increase. This is due to increase the contractility, increasing the heart rate, increasing the preload, decreasing the afterload. But the venous return curve shift upward to the right because of increasing of the mean systemic filling pressure by increasing the venoconstriction and the arteriole dilatation and the muscles pumps. As a result, the intersection point move much higher, so cardiac output increase much more than that of the inotrope alone. So to great increase the cardiac output is important to that the heart and the vascular system both work together. Alright, we've reached to the end of our MemoMap of the venous system. Let's quickly remember the big picture. First, we talk about the function of the vein, and the vein do two main functions, transport and reservoir. Second, we talk about the venous pressures. We have three important venous pressures: the central venous pressures, right atrial pressure 0 to 2, the peripheral venous pressure, the pressure in the vein outside the thoracic, and the mean systemic filling pressure, the pressure in the circulation when the heart stops pumping. Remember that the venous return determined by two pressures, the right atrial pressures and the mean systemic filling pressures. The third, we discuss the venous return, which is simply the blood flow back to the heart per minute. And the venous return equal cardiac output. It's controlled by two factors, the pressure factor, the venous return equal the mean systemic minus right atrium divided by the resistance to venous return, and the mechanical factor, the cardiac pump, which is ejection and filling phase, both increase the venous return. Thoracic pump, inspiration increase venous while expiration decrease. The skeletal muscle pump, of course, increase the venous return. And we talked also about three curves, describe the relation between the venous return right atrial. It is inverse with intersection plateau. Remember that the intersection equals the mean systemic filling pressures. The second is the venous return and the mean systemic filling pressures. When the mean systemic filling pressure increase, the curve shift up to the right. When it decreases, the curve shift down to the left due to changing the intersection point. And finally, the relationship between the venous return and the resistance, and this is inverse relationship. So when the resistance increase, the slope of the curves decrease and vice versa. Finally, we looked at the intersection between the venous return and the cardiac output. Both curves met at equilibrium point where the right atrial pressure 0, cardiac output equal 5 liter per minute. But with the inotrope, the point shifts slightly upward due to change in cardiac output slope increase, but there is no changing in the venous return curve. During exercise, both curves move. The venous return curve shift up to the right, cardiac output shift up to the left, so the intersection point move higher with marked increase in cardiac output. So the greater increase in cardiac output depends on the heart and the blood vessels working together. That's our MemoMap of venous system. See you next time.